Had a good group today.
Yep. We had
Last week, too.
37 in there yesterday, which we normally run around 20.
Mm-hmm.
So we had 37. I wasn't here. So it went real
What does
well.
that say?
Yeah. Hey, Paul's not there. Let's go in. Yeah. I talk too much. I'm anxious to get debriefed on some of the folks that were here. All right.
Thumbs up.
We're getting a thumbs up from our producer, Mr. Ryan. So welcome back to our Facebook Live. We do every week at Thursday at 11 o'clock. I'm Paul with Hyperbaric.plus. This is Keith with PrevailOverCancer.com. A wealth of information. And all of a sudden, everybody around here, I think maybe it's the time of year we're all talking about parasites. You know, it kind of starts with ticks. We're outside.
Right, yeah.
We're in the garden. And I've seen, in the last week, I've seen 3 different doctors send out interviews on parasites. I shared one of those with you yesterday to say, hey, is this something we should talk about? And Keith jumped on it with both feet. And so today we're going to talk about parasites.
That's right.
But he likes to do a little disclaimer to start, so we'll get that done.
So this information we're providing today is for educational purposes only. We are not your doctor, so we're not prescribing that you should do these things. If you hear, suggestions on things, but check with your doctor. So when we talk about supplements, we're going to talk about a few today. Supplements officially, according to the government, are not approved to diagnose, treat, cure, or prevent any disease. Once again, always check with your doctor for additional information and a testing assessment. So that's important actually with this topic for parasites is, do you have a problem or not? We're going to go into some of those symptoms, but matter of fact, on our websites at PrevailOverCancer.com and Hyperbaric.plus, at the bottom of my Learning Center page and on Hyperbaric.plus resource page, the handout.
Yep.
A lot more detail. Matter of fact, there's a lot of information. There's 4 pages of information.
I saw that, so I'm going to try not to talk today so you can get through more.
No, go ahead and talk. We're not going to go. We can't cover everything. Excuse me. We can't go through everything on this, but matter of fact, it's common. Matter of fact, when I was in pharmacy school, we weren't taught about parasites. Matter of fact, I don't even remember a course on anti-parasite drugs when I was in pharmacy school. Medicinal chemistry probably had something. Medicinal chemistry is actually looking at medications and their chemical structure and what they do. And we even had some natural. Matter of fact, most drugs originally came from natural products, and including some of the herbs we're going to talk about today. Those active ingredients have been used to make drugs, and they change the chemical structure a little bit to make a drug out of it. So then they can get a patent on the drug and charge big money for that. And so
for what we already have.
For what we already have. And sometimes the prescription things can be stronger. But, assessments are very important. Without that, we don't know for sure. Matter of fact, many of you are going to say, well, I don't have parasites. I'm not going to tune in. Let me tell you, you do have parasites, okay?
So in the 3 videos I watched, all 3 doctors said that the common response through the medical community was America, the U.S., does not have parasites.
Right.
And I think they were kind of equating that to maybe third world countries where it was rampant, that, you don't have the controls we have.
Right.
But we got if you've got a pet, you definitely have parasites.
Yeah. Did that pet kiss you? Did you wash your hand every single time after touching your pet?
Yeah. I
live in the country. Well, it doesn't make a difference. You don't have to be in the country, but I do live in the country. I've got all kinds of critters. We've got varmints, all kinds of varmints, out there. Rabbit droppings I noticed in my backyard the other day, and here I'm typically walking around barefoot. Yes, I do clean my backyard from the dog, but still, we're going to get parasites. And so I'm not panicky about that. I do these things, to help get rid of the parasites. So
at least understand that you could have them, and the body will take care of it for the most part until it doesn't.
Right.
I mean, if you get overloaded, that's when you get in trouble. So we want to know when we're overloaded.
Yeah, many years ago, I had a patient who came into my pharmacy, and she was having some problems. And matter of fact, she ended up with cancer, and I found out later. And but she had some emotional issues. And one evening right before closing, she came to me and said, Keith, I had a bowel movement and I saw parasites in my stool. And I have to admit, once again, trained as a pharmacist, my first thought was, lady, why are you even looking? And I thought she was crazy. Well, she probably did have parasites, And so now if you start studying this, matter of fact, even the CDC does talk about parasites. It is a common problem. Most of you have some parasites. We have them in our body. So once again, I don't want to panic anybody, but if you have some other health conditions, you maybe should be paying attention to that.
Yeah, do some testing and make sure it's not overloaded.
Exactly. So
we love questions. So if you'll send questions in at about a quarter till, we'll pull the questions out and start answering questions. So I'm not going to talk today. I want you to get through as much of this because it's important.
But ask questions.
Yeah.
So other people are going to have those
if
questions
I got
too.
a really good pertinent one.
or a thought on that. So so matter of fact, I've got all types of information here. I'm going to read off the handout and go off the handout to help me to stay on course, with most of this information. So matter of fact, actually, to be honest, I'm not even going to say most of these terms. I can't even pronounce them. Okay, there's some Greek, Latin, species
just
terms.
Refer to that.
So just refer to the handout, okay, on that. But there's all types of parasites that we are exposed to.
Not only is there 4 pages, but you reduce the font so much. I got to put my glasses on.
I have my bifocals on too.
All right,
so
I'm ready.
Matter of fact, I even enlarged the print. So from there's so much information.
I get you.
There really is.
I get you.
And so parasites actually means that's an organism that lives in our body. And that can be anything from, we think of worms, intestinal parasites, to, insect-borne, type things. And so those can be, whether it be viruses or bacteria type items. Funguses can be parasites. That's another one we probably should work on another time. We've done some things about that. And then viruses are going to be another parasite living in the body, living off of our body, off of the nutrients in our body. So there's many different types of parasites. That's another one I think that we probably should talk about. Another topic would be viruses, to go into more detail about the health challenges that can occur with that. So, I do have clients that have some cancers that are, probably caused by a virus parasite. And just a chronic, long-term, type issue. Matter of fact, actually, parasites, and most people don't know this or think about that, but some parasites do increase the risk of cancers. And the way that works, whether it be a virus or a parasite, is this inflammation process going on long-term. And that inflammation is damaging to the DNA and the mitochondria in the cells. And so if the DNA is damaged, but if it's damaged to a certain way or that cell continues to grow in a different way and pass that ability on, now we have a cancer or a tumor. So, and definitely some parasites are like that. Since my channel concentrates on cancer, there's actually a biliary, bile, gallbladder type parasite that gets into the body that increases the risk of those cancers, gallbladder and bile tube cancers, and then bladder cancer. Another parasite is commonly known to be risk factors for that. Now, you can still have actually those cancers without those parasites, but it's still some type of inflammation type thing, is contributing to that. And so actually, matter of fact, those cancers are also at higher risk for a person exposed to environmental toxins day in and day out, cleaning supplies, petroleum products, disinfecting byproducts from swimming pools, all kinds of things that can create damage and irritation to the body. So there's many different type things, but parasites are common. So don't just blow this off. Okay, so this is important information. So I do have information about the cancer type information on the website. There's not many known cancers caused by that, but there are a few. So signs that may warrant testing, and yes, it's a small print, so yes, I'm going to have to look close, on this to make sure I cover everything. But persistent diarrhea, blood or mucus in the stool, greasy floating stools, unexplained abdominal pain, bloating or gas, nausea, fatigue, unintentional weight loss, iron or B12 deficiency, nighttime anal itching, new skin rashes or itching, eosinophilia, that means increased eosinophils, that's one of the white blood cells that's in the body. Higher suspicion, a person that's been traveling, that increases the odds, but that isn't always the case. Matter of fact, I've had a lot of these symptoms over the years. So, and I have done some international traveling, but I was having problems before I did that traveling. Drinking, or rather being exposed to well or stream water exposure. You don't even have to drink the water. You can actually get some of those things, from exposure. And if you don't wash your hands or disinfect your hands or your clothing, undercooked meat or fish, daycare contact, pets, livestock. How many of you have a pet? Okay, and I've got dogs, cats, horses. I've had goats. I've had a lot of different things. And then those with a weakened immune system. So, I'm going to mention something too. So that weakened immune system can be something known. Like actually my wife has actually had some problems with some of these things because part of her immune system doesn't work. So she's lacking the ability to make IgG for a reason. We don't know why. It's not a genetic reason that can be a cause for that. But she's very susceptible, and she's actually had some of these parasite infections. Once after going on a trip, actually a vacation, we're at the lake, our extended family, kids and grandkids and us, and she was the only one that got Giardia from water.
Out of how many?
Out of 9 of us. The only one. And so, but her immune system isn't strong enough. The rest of us, our immune system was strong enough to keep from having, in this case, diarrhea. And then we had chickens, and a few years later, she had, got an infection of salmonella, another diarrhea type thing. Well, we ended up letting those chickens just die off, and I haven't had them again since. So even though we're kind of treating them, but as a matter of fact, the state got involved in that one, the health department. Okay, what were you eating? Where'd you get it from? And once again, we had chickens. And the free range, I mean, literally free range, they were everywhere. We'd pin them up at night, protect them from the coyotes and skunks, but then, during the daytime, they were everywhere, and they were pooping everywhere. And yes, we were walking around, once again, country life. We all have these things. And so even if you live in town, you're going to have them. Matter of fact, one night when we were living in town, I noticed that our dog food is going quick. We set the dog food out and it's gone. And then I got a feeder, one of these trapdoor feeders. Well, that wasn't helping. We're going through a lot of dog food for just one dog. And then one night we're watching TV and I looked, there was the biggest raccoon I've ever seen in my life. It was at the back door in the middle of town. Okay, and so we're going to be exposed to critters and parasites. So this is going to happen. But if you have any of these symptoms, you've got to get, matter of fact, autoimmune symptoms. Common type issues. Matter of fact, I used to test positive for rheumatoid arthritis. I've got, who knows? As a kid, we'd go out, traipsing to the pond and getting frogs, and we had all kinds of pets and reptiles and fish. We're all exposed to things. I probably had some parasites for many years and didn't know it. My eosinophils that we talked about earlier, I had a history of those being elevated, and they'd kind of go up and down, up and down. I felt like that it was probably caused by a gluten sensitivity, because every time I decreased my gluten, the eosinophils would drop to normal. So eosinophils aren't just parasites, but that's definitely one of those signs. But actually the gluten was becoming a damaging thing in my body. And so the eosinophils were trying to get rid of that gluten evidently, or something that was in that. So, but we have to assess and figure that out. Whatever the problem is, if you have any of these health issues, those are common things. They could even just be some fatigue without unknown reasons. B12 and iron deficiencies can also be caused by other things too, like low stomach acid. So we have to assess and don't guess for all of these health issues. Okay.
I assume you're going to get into some testing.
Yes, we're going to get into testing. Exactly. So how to test? Number 4. Yes, that's right.
Good.
So good. Exactly. So, the first thing to do if you have these symptoms is seek some assistance. I mean, you can try to figure it out, yes, but get some testing done. And, if you have some healthcare benefits, definitely, like my wife, we did a stool sample through the doctor, through the hospital. Yep, found out she had Giardia, she had Salmonella. And so therefore we were able to take the right product to get rid of that. And she got over it. So, but the doctors were trying other things unsuccessfully until they finally did that test. And it's covered by the doctor, by the hospital rather, and insurance. Didn't even cost her anything. But that's not the full picture. And so sometimes we have to step outside and do other tests for that. So let's see here. So there are ova and parasite tests. They can look with a microscope and look at a stool sample. Veterinarians do this all the time. So I took horses in once because my horse was losing weight. She was older. I just wanted to make sure, and they actually did a fecal sample, looked at the microscope. Nope, no eggs. Okay, because I've been treating her, but actually it turned out her teeth were just bad and just old, and she wasn't absorbing nutrients well. So there's also antigen tests and stool tests that are available for the parasites. There's a pinworm tape test. You can actually, sounds kind of weird, but take some tape and tape that to the anus, when a child is sleeping or adult, and while sleeping. And while we're sleeping, and even one person earlier in the group was talking about they were doing an intestinal cleanse based off of the moon. And so a full moon has a tendency to create the worms to become more active. And so actually this person, he was not able to actually have a bowel movement during the full moon. And so that's kind of one of those signs maybe of a parasite load. So many of them it couldn't pass through. But you put the tape on there, take it off in the morning, and see if you can see eggs, because those worms will come out. They'll lay eggs around the anus, and little tiny eggs. So that's another way to get an idea. Blood tests, and then also specialty tests. And so there's one test available, like parasitetesting.com, and then I have another link to another one called a GI map. The parasitetesting.com is more specifically for parasites. The GI map is actually all of the bacteria and parasites, more expensive. It's about $100 more than the other one. And so it is expensive, but you send a stool sample to these labs, and you have actually laboratory equipment specialty, and they can tell you exactly what it is. Mm-hmm. With that, then you can be more specific and find out what to do. And so without testing, you just don't know for that.
Now, you earlier in the chamber, you were talking about one of your patients that spit up what I'll call a fur ball.
Oh, yeah.
Like a cat hacks up a fur, and it was obstructing and it making you cough, and all of a sudden they passed it. And my first question is always, did you sample it? Did you keep it?
Right.
Did you test it? What was it? And in one of the videos I watched, they were talking about the exact same thing, and they finally hacked this up, and he called it the mother tapeworm.
Yeah, well,
it had been
a big worm.
It had been in their body for a long time and creating a lot of havoc. And after they passed it, after they were able to hack it up, because it attached in their lungs as it makes its way
through the body.
I think it was a heart. It was a type of heartworm.
That doctor was talking about a heartworm.
Yeah, they got to the lungs, and then they were able to kill it. However, they oils or whatever.
Right.
And they finally passed it by hacking it up, because it's going to come out of your lungs to hack it up. And they called it the mother tapeworm. And this person had all kinds of issues for a long time. And after that came out, all their issues were gone. All their inflammatory issues, everything.
In that case, that person's autoimmune problems were
exactly
resolved. Right.
So, and what was it? I mean,
that's
if you ever pass something like that, at least question your doc. Say, hey, I got this thing, and question the doctor and find out, can you test it and make sure you're done with it.
Yeah, and so I mentioned earlier, my first reaction many years ago was, lady, why are you even looking? Well, we should be looking at bowel movements, okay? We should be looking at urine. We should be looking at what we cough up, what we blow out our nose, and just kind of double checking things just to see if there's anything weird. And if there is, matter of fact, nowadays we have phones. We can take a picture too, to help get an idea what's going on, and show that to somebody.
Where's a microscope? I mean, microscopes aren't that expensive.
No, they're not.
That'll go to some power.
Yeah. Oh, yeah.
And man, talk about interesting in a science class.
That's right.
I mean,
oh, yes.
And I'm understanding that there are microscopes that'll actually attach to your phone that'll go to a very high power, so you can take a picture with your phone. And it's not on a slide per se, but it will go to a high power. You can see crazy things. I'm blown away by, and they're not very expensive.
Yeah.
So do you have any? If you were to go buy a microscope, do you have a path? Do you know what to look for? Because we're talking about look. I mean, you're saying look at it. Well,
look at it. Well, look at it. So I'm talking about it. If you can see the worms, I mean, that's of course a major concern. But yeah, some things we can't see. That's correct. Yep. So that would be another option, is to do to a certain extent, your phone can have a little bit of a zoom effect, and I'm sure there probably are lenses that you can attach to the phone over the camera that can have a microscope type effect also. And then there are
magnification is kind of a starting point for a lay person.
I don't know.
You don't? Okay.
I don't know enough.
I figured you probably.
It's been too long. Matter of fact, microscopes we did that in chemistry all the time, and biology all the time, looking at things. So. But I don't know enough about that.
No problem. I didn't mean to go there.
No, that's okay.
I told you I was going to be quiet.
Some people are like digging. I mean, which is great. Trying to why? And that's always my question now is, and when something's going on, if somebody's diagnosed with something, instead of just say, here's what you take for that, is more like, why did that happen? Where did that come from? What is in that? And so, then once again, this other lady, she just, one of my clients, she coughed. She had it's more like an autoimmune thing where they felt like her body was attacking her lungs. Well, she ended up coughing this plug out, and then later, and there's probably a few different times of that, a few different coughs of that coming out, and then no evidence of disease. So, matter of fact, another thing too is that sometimes, matter of fact, there are, when you get a scan, MRI or a CT, and sometimes they'll say you have a cyst, in your liver, or in your lungs, or wherever,
Or you have a ball of parasites.
Maybe, maybe you might. And so once again, don't panic. And matter of fact, I know people with those for their whole life, and so it's just there. It could even be an encapsulated, where the body has encapsulated and killed it, and there's a scar tissue left over from that. So don't panic, but it's almost like, okay, we got to follow up with the scan to make sure that that's not growing and getting bigger, with that. So, but there are tests available for that. And then, by the way, I forgot to mention also, if you have questions about parasites or cancer type items, submit those questions. Ryan, our producer, is going to print those off for us in about 20 minutes or about 15 minutes, so we can go through those questions. So,
or if you're one of those inquisitive people like I've been describing, and you have a microscope and you get joy out of it, tell us what it costs and what magnification it goes to, so we can play.
Yeah, that's right. I have a friend. She's got a microscope, and she loves looking at stuff, at water and things like that. So, once again, bugs are everywhere. Okay.
Well, you can take those snapshots now and put them into chat, and you know exactly what it is. You don't have to be the smart guy that says that's a Protozoa and that's a
right.
I mean, take a snapshot of it and put it on.
It's usually correct. Yes.
Yeah.
It's usually correct. Yeah.
So
that's correct.
Anyway.
Using those tools, I agree with that. So I did list. So once again, these handouts are available at hyperbaric.plus. Resource page, and prevailovercancer.com at the Learning Center, at the bottom of the Learning Center. Click on that, and this will open up listed under Seminar Parasites. So, and there are sometimes, actually, I'll admit, sometimes we have to go with prescription type items, okay? So my wife was having the Giardia and the Salmonella. Those are serious things, and actually, we did do a bendazole type item for the Giardia, And matter of fact, that's probably the only thing that's available. There are actually doctors in the United States that specialize in parasite infections, and we have one here in Oklahoma City.
Cool.
And so he specialized. We went to him, and they they prescribed the drug was actually $6,000, for that Giardia treatment. I now have learned that I could have gone to Tractor Supply and got it for $15. So anyway, so same thing exactly. So anyway, so
isn't that crazy? That is so frustrating.
I know, $6,000. So prescription drugs though can have an impact. At that time, as a pharmacist, I didn't know that you could do some of those things. Even though I had horses, I wasn't aware of some of those things that would be available that would help with that. Actually, I was starting to figure that out at the time. So it's a learning process, and you're learning. We're learning, with that. So, but there are prescription drugs that do help out with several different types of infections. So, including the bendazoles, and so albendazole and mebendazole are approved for human use. And albendazole is one that my wife had to take for Giardia, and very effective. And then Foodborne actually falls in that class, but it's not approved for human use. It's approved for animal use. And then parental pamoate, a common one that actually is available even without a prescription for roundworms for kids. It's a OTC item you can buy without a prescription at lower doses. And higher doses that may be necessary sometimes. You can get a prescription for that. Ivermectin has been approved for certain types of infections in humans. And then a couple others that are actually hard to pronounce. They're not as common. But another one that's commonly used is metronidazole. So, matter of fact, they'll add metronidazole to some infections. And so some vaginal infections, actually, metronidazole works very good to kill those parasites with that. So they'll actually combine that with other items. Okay, I'm going to switch pages.
That one that starts with a P, because I hear about tapeworms, flukes. I hear about those all the time. Prez and Quantel, whatever.
Yeah, right. I can't pronounce that one. I haven't practiced that one yet.
So anyway, that's I hear about tapeworms and flukes all the time.
Yes, it's common. It's extremely common, and so now some herbal things we're going to talk about that too.
Good.
That the average person, or in maybe even other countries, and some of these items are also they'll vary based the natural products. Any prescriptions will depend on where you live. So, not all regions of the world have all of these same ingredients. Right. And so a lot of them are going to be oils. And we were talking about that in the chamber. Matter of fact, another thought about the chamber. So the chamber opens up, improves circulation throughout the body. And one of my tricks that I recommend for my clients and myself is I take some of my therapeutic items before I do the dive, because I want to make sure that that's getting in all the little tiny nooks and crannies throughout the body. So the Hyperbaric does improve circulation. So let's see. Turn the page over. Let's see. Parasites. So, prescription treatments. See if we did that right. And I think my numbering is off definitely. So, common parasites. I have a whole list. There's probably about 12 different parasites that are common, and I've got listed where they come from and then their health concerns. Many health concerns. If you have chronic health conditions, you need to do some testing, okay? And matter of fact, what's nice is in actually most states, you can actually do these tests without a doctor's order. So you can order these tests that I mentioned earlier at parasitetesting.com and a GI map off of my website and find out if you got a problem.
Don't you order a fecal test is probably the most
stool,
common. That's
exactly.
A baseline and
stool test.
And you call, you get online, you order it, they send you a kit, you do the deal, send it back to them.
That's right.
And
it typically takes about 2 weeks to get the results.
Without a doctor, you can find out if any of these parasites are in your system.
Then you got a better idea about what to do for it. And then there's also the insect-borne vectors or concerns. And so there's the protozoans that cause malaria, babesia, which is more along the lines of the tick bite, and Lyme's disease. the kissing bug disease. And so, these bugs, when they bite, they transfer the bacteria into the body, or some of them burrow into the skin. And so, matter of fact, I got chigger bites. We were talking about that earlier. And chigger bites from me being out and working in the yard, in the garden. And so, I can guarantee, due to the way I react, they're transferring stuff into my body. So I'm not too concerned about it because I take some anti-parasite type things.
Well, it's that they transfer to your body and makes you itch. I mean, that's where the itch comes from.
And that's where, and it's kind of interesting, why do some people react and others don't? I don't know. I don't know for sure about that. And so I know once we stayed at I won't say the name, we rented a cabin, and I don't want to kind of blast a particular company, and anyway, bed bugs. I got bit by bed bugs. I was the only one that had the bites. I reacted to that. So something about my body shows up, or histamine levels are elevated type of thing. But at first I thought they were probably mosquito bites, but then I realized that they weren't. So bed bugs. My wife didn't appear to have that problem. She was being bit too, but just didn't react to it. So my immune system was reacting to it. And so, but I've got listed those parasites, that can come from these insects. And sometimes those eggs will get into the body, and travel through the body and get to different regions. And everybody's different. Some people it's going to be a neurologic issue. Some people it's going to be in their lungs and their heart, in their intestines, the kidney, their bladder, their pinky toe.
And people say, "Oh, I took an antibiotic for that particular bug or that particular, I did all that." Well, what people don't understand is what they secrete, what that bacteria, what those parasites secrete actually can create a biofilm. And so that's bile. I mean, they're secreting, if you want to call it defecated, they're getting rid, they're eliminating things from their body, and it's creating problems in our body, and it's protecting that so antibiotics can't get to it.
Right.
So the things that we're doing don't have an effect. And that's where you get into particular oils that'll break down those biofilms. So that's where oils come in.
Exactly. Oils, they do work and help out. It's not an instant, easy answer.
Right.
And so once again, we need to know what we're dealing with so we can actually be more specific on even those oils, as to what the oils or prescription treatments or whatever we're going to be doing, with that. But so they have a tendency to, they're a living organism in the body. They will secrete things, and it's not like they're smart, but it does create kind of a barrier, and then the immune system cannot get to it and get rid of that. So, and we will use the oils to help out with that. So, matter of fact, I don't like to rely on any one thing. So, if they find that yes, there is a prescription drug that's going to help at this stage in my life and my knowledge now, I'm definitely doing other things.
So, I'm just going to touch on this real quick because this wakes people up. I had a call yesterday while I was mowing. I stopped and took a call. It's a God thing. The gal that I was talking to said that she has Lyme. She's been dealing with it for some time, several years. And I said, when this came on, I'm just curious. I want you to think real hard. When this Lyme attacked, when it became known that you had a problem, were you going through any kind of traumatic situation? And she goes, no. And I said, have you ever had a fever through COVID maybe? And she goes, oh my God. As a matter of fact, yes, I had just got finished with COVID, and I was working 60 hours a week.
A little stress.
And all of a sudden, I have this, my life went in the toilet. And she goes, no one's ever asked me that question. And so now she's starting to connect the dots. I said, virtually everybody in the chamber that's dealing with Lyme can go back and find that trauma. Because what's happening is that Lyme bacteria is getting into your into your muscle tissue. It literally corkscrews in, covers itself with a biofilm, and it's laying dormant. And it'll lay dormant for many, many years until you have that traumatic event.
Right. Your immune system is actually helping keep it that way, kind of keep it dormant.
Okay, well, I'll let you explain that one because that's above my
So
pay
the
grade.
immune system is kind of definitely working. So it's not like it's not, but it's kind of working, helping keep it from replicating and growing and creating an environment that keeps it from growing. But when we have some stress, now our immune system doesn't work as good, and our cortisol level drops. Cortisone that our body makes, cortisol, decreases inflammation and pain. And whenever we're under a lot of stress, we don't make as much of that, so now we're feeling it. Okay? So it's probably a process definitely was going on, but now the stress, has allowed that to express itself.
Literally every one of my Lyme clients that come here and dive with us and learn more about what they're dealing with, because still the medical community doesn't acknowledge Lyme disease. That's changing. RFK Jr. did a roundtable back in December, and we're starting to see the CDC coming around on, yes, Lyme exists and this is how you deal with it. But everybody here can go back and find a traumatic event that all of that Lyme came out of hibernation and attack their body, and they never know it till they get in there and start talking to other clients.
So, matter of fact, I talked a couple of days ago, 1 or 2 days ago, I talked to a new client that contacted me, and her son had some issues, actually a football injury. Matter of fact, you're going to recognize this story, a football injury, or you probably will. And he started having a lot of problems, and they discovered he had Lyme's. So actually, he did some dives and got better. Then he was in an auto accident and had a relapse. And now, so we were talking through that stress, that physical stress, emotional stress. They're going to contact you again. Okay, they're coming back. So because that was the one thing that seemed to be helping him. And then once again, they kind of a whole new set of problems, and they just kind of forgot about that. So yes, in this case, try to explain this so that social media doesn't get too upset about it. But the nitrogen bubbles that occur while diving, helps to expose the spirochete, and so that the immune system helps it to break up. And so the immune system then will start attacking it and get rid of it. So on that, so that's that the 75-foot dive is geared for that. So that we did, actually it's not a dive, but 75-foot. What we call it?
A session.
75-foot session. Yep. Okay, on that. Okay, so herbal approaches, and so wormwood, artemisia or artemisinin, which is the active ingredient. Matter of fact, a lot of these things are also anti-cancer. So cancer cells can actually have some DNA from viruses and parasites and fungus inside those cells. So so there's a lot of anti-parasites that also have some anti-cancer type actions, but cancer cells are also cells that are dividing and growing inappropriately, like parasites. And so cancer is it's actually some of our own cells that are acting like a parasite, okay? And they can be altered. But black walnut hulls, we're talking about that. Cloves, that's a common thing that I put in my coffee most days. And then I had another thought too. Do you add some kind of a little spice or something to your coffee, don't you?
We put Ceylon cinnamon, the roll of cinnamon.
Tastes good.
Oh, isn't it? Yeah. Everybody says, what's
delightful.
different about your coffee?
I know. I didn't bring my cup today, so I didn't get that today. But yeah, it's
delightful. And he won't drink out of our styrofoam cups.
I won't drink out of styrofoam. So I passed on the coffee.
I get it. I mean, I tell everybody, bring your stainless.
I was running late, and I started to go back in. I don't have time. I need to get here, and I want everybody waiting on me, so I normally have a cup in my truck, stainless steel cup ready to go.
So Keith, as people are going through these herbals and they see that this works for that, man, you got to be so careful because these things can be toxic.
Yes.
People see wormwood works for this. Well, too much wormwood
Actually
is
creates
going to create
some
problems.
neurologic
Yeah.
issues. And so too much wormwood can actually create Parkinson's
Yeah.
type symptoms.
Yeah, so you need to have
Yes.
guidance when you get into
Yeah, so,
this stuff.
so be careful. That's why I don't have dosages on here. So I think we do have to be careful
Yeah,
about that. I'm
so-
glad you mentioned that.
Yeah.
So seek some professional assistance and be careful about that. So yes, wormwood, so we have to be cautious about some of these type items. Berberine, great for protozoans and also for blood sugar control. Garlic, a broad antimicrobial type option. Papaya seeds and ginger, oregano oil, neem, and pomegranate. So all types of nuts and seeds. That's one of the reasons why I like to do those is eat those and different ones all the time. I eat nuts and seeds every single day, and I probably eat 3 servings of nuts and seeds a day. And so I think they're that important.
We had a question on oregano. What was that question?
What are the benefits of oregano oil and the parasitic infection?
I didn't hear the last part.
I'm sorry.
What are the benefits of oregano oil
Oh,
and parasitic infection in humans?
okay. So any of these oils that are listed here, they actually will eat away at that at a parasite, that hard shell that's on a parasite. That's the skin, and we'll call it the skin, our shell on the parasite. Eat away at that and expose it so that it starts decaying, and then the immune system is supposed to go get rid of that. And so,
And I think part of the question too was difference in the herb itself and the oil. So,
okay, yes.
so the oil is a high concentrate. I'll let Keith
Yes,
answer that.
oil
problem.
is highly concentrated, and an extract of that oil, of course, is going to be thick and concentrated. And so oregano, I've got in my garden, and a little bit of it, isn't going to have a great impact. But you can concentrate those oils, and it's 10, 20 times stronger probably. And so sometimes they'll even mention that it's an extract, and then a quality company will not just list those ingredients, but they'll even say how many milligrams or the extract strength. Like one capsule may be equal to 11 times the herb or something like that. So sometimes that's what those X's mean.
I always tell people that, hey, you can eat that oregano or you can eat that garlic. You can do all those things. Eat the lemon.
Yeah.
You can do all those things. That's good. But when you take it in, we were talking dosage. So when you take it in a real high dosage, a therapeutic dose, that's what the term therapeutic is. It means that you're getting enough dosage to make a difference. Am I right?
Yes, that's correct.
So I need you to back me up on this.
Yeah.
If I say something wrong, I need you to tell me.
Sure.
But anyway, that's I think what your question was. What's the difference in eating the herbs and consuming the oil? Yeah. Yeah.
Okay. Yeah, good. So there are questions. Oh, look,
Wow.
we got a lot of them. So
Looky here.
pumpkin seeds. I eat pumpkin seeds almost every single day, and so they're one of my favorites. There's a lot of protein, a lot of great things,
And not the salted, roasted pumpkin seeds that I became addicted to at Costco.
And so roasting them can damage them to a certain extent, and depends on what other oils they're roasted
Exactly.
in or sprayed with or whatever. And so actually, if you want to roast them, make it yourself. Okay,
I got a 5-pound bag of organic, like you told me to, and I've made it up with chia seeds and another one. So anyway, I got 3 seeds that every time I have anything, soup, salad.
Yeah, you just put it in on
I haven't
stuff.
put it in my eggs yet, but soup
That
and
would be
salad
good, yeah.
it would.
Yeah.
So I have to try that.
Yeah, matter of fact, I'll put broccoli sprouts on everything. Everything.
Sharon's whipping up another batch of broccoli sprouts.
Yeah, it's about time for me to do
she'll-
another
yep,
batch for
yep.
me too. So who's going to be at higher risk of problems? Because we're all exposed to these. We all have these, and some people are going to have more problems, and that's going to be people traveling to certain areas where there's not as good sanitation would increase that risk. Young children, because their immune system may not be fully developed, or they're doing things, they don't wash their hands every time before they put their hands in their mouth.
Or they eat grub worms.
Right.
Yeah.
Or this one doctor was talking about, this child was going to the chicken coop and eating the chicken poop,
Yeah.
every morning.
Thought
So,
it was candy.
yeah. And then, people exposed to untreated water. Like I mentioned, my wife, once we were at the lake, And so, she was drinking the water from the well there that's provided at the RV park, but we were also swimming. So she may have swallowed some water from the lake. Anyone eating raw or undercooked meat, fish, produce, and yeah, I have to admit, I do organic, so I'm not putting pesticides on myself, and I will sometimes eat some of those things raw. I take anti-parasites. So pet owners, farmers, those with soil or animal contact, immune compromised individuals, and so people taking medications to shut down their immune system due to maybe transplants or chemotherapy or chronic steroid type things, those people are going to have more problems with that. So, but be sure and check with your doctor before to find out what's going on, or do those tests like what we mentioned. There's other tests like Lyme's that have to be done, and that's a whole nother topic. So, but there's many different things that we can do. And then let's see here. Prevention, washing hands, cooking, wearing shoes. Matter of fact, I have some shoes that I wear now that I found the rabbit pellets in my backyard. I have some sandals I put on, I slip on before I walk out there now, because I take care of those rabbits, get rid of those rabbits. And wash clothing on a regular basis, and assess, don't guess. So that's very, very important. Okay. Questions?
I can't believe you pretty much got through all that.
Well,
but you all still have to go and look up those parasites.
I skipped several
names.
sections.
Yep.
Download these guides.
Yep.
Okay, go to the websites and download the guides. So, matter of fact, we're going to try to get through this list of questions. Wow, 20. Okay, we'll get through what we can. So, do you need 30 milliliters of olive oil to take Finben and mebendazole? Seems like a lot. Actually, I typically, for my clients that are taking those, I'll recommend more like a tablespoon. You can only absorb maybe a tablespoon of a fat at one time. So 30 milliliters, which is 2 tablespoons, may be too much, and that may act as a laxative.
Well, in other words, you'll know.
Yeah, that's right. You'll know. And some people can do it, some people can't,
Yeah.
on that. But 30 milliliters is a lot. I typically go with more like 15. Love your education, guys. Thank you for what you do.
Well, thank you.
Yeah, isn't that neat? So how much of a risk factor are everyday pet habits like bed sharing and letting dogs lick your mouth? We were talking about that one earlier. When it comes to human parasite transmission, it's going to happen. Mm-hmm. But not even that. Well, if you just think about it, the dog's out licking and eating things, and then they come in and they're around you, they're in your bed, they lick your hand. Did you wash your hand every single time that they licked you, or that you... Oh, well.
So those parasite eggs are going to be transferred to that dog's fur, that dog's coat.
Sure.
So, I mean, you can't miss that, and you're transferring.
That's right.
When you pet that dog and then you do whatever, and those little bitty eggs that you can't see are making their way around.
That's right. And so there's a reason why you give a dog anti-parasite every month, okay, and cats, and horses are every 2 months, okay. So there's a reason why you do that. Will you feel if there's something inside you and should you seek medical attention? Well, you won't necessarily feel something inside you. I mean, you might, but I wouldn't expect that. But it's actually, something's wrong. You don't feel good. And it depends on the person what that is. But you don't feel good. And once again, check out the symptoms that I have listed on this handout. Everything. Well, if you don't feel good, something's not right, figure it out. And so I do use some online assessment forms to look at that. I have a client that's kind of coming back around to see me. I'll see them tomorrow, and I'm having him fill out a symptoms questionnaire to be efficient in that, so that we can cover things. And so I have to play 100 questions. So he'll fill that out ahead of time. But no, you don't always feel something inside you. But yes, if you don't feel good, seek some help, and don't, if they say they don't know what it is or it's just in your head, keep working at it.
Go somewhere else.
You know something's wrong. Okay, you don't feel good. You're fatigued. Something's not right. Keep working at it. What are the benefits of oregano oil on parasitic infections in humans? It definitely is part of what I will use. And so I do have a combination capsule that has several different things in it. And so we will go about that. So how about prostate cancer? I've not seen any specific issues on prostate cancer with, and matter of fact, most other cancers, not specifically, but inflammation is a driver of cancer. And these type problems create inflammation. And so indirectly, it could be a issue for prostate cancer, to answer your question, but almost any other cancer. Anything that's going to create inflammation is going to be related to that. Androgenic alopecia. I haven't seen androgenic, talking about actually testosterone, androgens. I have a tendency to, for some people, it's genetic actually. DHT, dihydrotestosterone, actually causes the hair follicles in this region to go to sleep and not work. And so there's this male pattern, alopecia. Male pattern is kind of, we think of for guys, but women can have the same type of problem. I don't know that is directly related to it, but I'm not an expert on that either, so I haven't evaluated that. So what's up with the Joe Tippins model? I don't know what that question means, so I'm not sure. So reach out again.
It's continuing to have great success, and it's being modified as it goes forward. They're doing some changing.
Definitely. I know Joe and Joe Tippins, and I don't rely on one thing, okay? I'm going to do several things for life-threatening conditions. I was born in 1963, and I can remember in my childhood we had worms and parasites and were treated. My grandmother said they wouldn't eat for a day and would hold up a bowl of milk. Have you ever heard this one or not? Okay, so you don't eat, and then while the child is asleep, you hold hot milk underneath their nose, and a tapeworm will come out through the nose because it's hungry, and you grab hold of that tapeworm and pull it out.
Okay. I never have heard that.
Yeah, so
warm milk under your nose.
Oh, yeah. Now, this person actually said that they would take hold a bowl of warm milk, and tapeworm would come out, warm milk in their mouth, and it would come out their mouth. So hold the milk in there, and that tapeworm, you could feel that swimming. So, so yes, some things you can feel, there's a problem. And
because they're hungry.
Yeah, they're hungry.
And they know where the milk is.
Exactly. Exactly.
Wow.
Yes.
So I'm going to think that's fat probably that they're going after.
Actually carbohydrates.
Carbohydrates?
Yeah, carbohydrates in the milk.
Okay.
And so milk has a lot of carbohydrates, sugars in them. And so, yes, I forgot about that story. But, yes, that is one way to pull those suckers out. So
you never know what you're going to learn here.
And so sometimes some parasites even, in the skin, they'll actually, take them and they're like a little tail, and they'll tie those and with a toothpick and so that won't keep burrowing, and then they'll keep twisting that toothpick and keep gradually pulling it out, but it's got teeth in there, so it doesn't want to let go. So they kind of gradually, and it takes quite some time, days, if not weeks even, to pull that parasite out of the skin. So there's all kinds. Matter of fact, we have a new parasite that's actually, now in Texas, affecting cattle skin. What's it called? I went blank.
Hey, Doug, what's that parasite?
Screwworm.
Yeah.
Screwworm. And matter of fact, not just cattle.
Yeah,
Goats,
everything.
dogs. Yeah, and so any mammal.
And I'm a hunter, and it creates a huge ulcer on the skin of that animal.
That's right.
And
Anyway, so I can't poop no more. What do I do? Please help. Well, seek some help. Figure that out. And so there's a reason behind it. I could say do some things, but then we're just treating a symptom. So I'm not going to say that. You need some help. So seek somebody to help you with that. You may be already, but if they're not working, they haven't figured it out what the problem is. So, that's not a normal type situation. So what can we do to pull calcium from blood? We are on Foodborne and lots more, but a doctor wants chemo due to high calcium levels caused by the big C, and the holistic protocol we've been doing is not lowering them. I'm not sure exactly what's going on, but I do use vitamin K2 to help move calcium into the bones. But there can be a parathyroid issue going on, or vitamin D deficiency, or even extremely high levels of vitamin D can cause elevated calcium levels, but also bone breakdown. So once again, there's half a dozen things. So it's hard to answer that question. But keep working on that, trying to figure that out. So what about binders? Well, binders may help trap some of the parasites that are inside the intestines, but they should not be taken all the time. They will actually bind up good things and bad things, including toxic metals. There could be definitely a time and place for them, but I would not be doing doing binders all the time. Greetings from Western Massachusetts. How about that?
Cool.
Can you talk on methylated versus non-methylated B vitamins when it comes to support of the terrain of someone with cancer? So very briefly, because we're almost out of time, but methylated B vitamins are what our body uses. Synthetic vitamins like folic acid and cyanocobalamin has to be changed into methylfolate and methylcobalamin to work. They actually could become a growth factor and increase the risk of some cancers if they're not methylated, and there's genetics involved. But so actually about 2/3 of the population have some issues with converting synthetic folic acid into methylated B vitamins. So
isn't it safe to say that if you're going to be doing those B vitamins, get methylated and cover the bases?
Exactly. That's what I do. I do methylated. Yeah. Exactly.
Even if you haven't been genetically tested for the
MTHFR, gene, which I have, and so I have a tendency I have a problem with that. And matter of fact, for many, many, many years, I took a folic acid supplement. That was wrong. And even years ago, when I found out I had that gene, I just took more folic acid. That's what we're told to do. Well, that was wrong.
And it's not that much more expensive.
Not much. It is a little bit more. Yeah, it is a little bit. So, but there's many different companies that have those methylated vitamins, and there's a lot more questions here. But where do I get the test? So on my handout, I've got that information. But there's what's called a GI map, GI-MAP. You can find out people that do that test, and then also parasitetests.com, I believe is what it is, has also a simple, fairly inexpensive test. So finish the questions. So we're not going to be able to finish all the questions. So I think we're running out of time. So I think we got another dive.
We got a bunch of people ready to jump in the chamber.
So we're not going to be able to finish the questions. Ryan's letting us know we're about out of time. And so Ryan, did you want to come by and say hi or anything?
He won't do it. Okay. So Keith, thank you for all you do, what you bring to us. Keith with PrevailOverCancer.com. I'm Paul with Hyperbaric.plus, 122nd in May in Oklahoma City. If ever you're doing a flyover, stop in.
Yeah.
We got a lot of people that are online that are not from around here. So anyway, that's what we're doing this week. I got a feeling we're going to talk about viruses next week.
I think we should.
Yeah, let's get into viruses next week. Hope you'll tune in. And with that, we're going to be out of here.
Okay,
thank you,
great.
Keith.
Thank you.
See you next week.
Thanks, Ryan.
All right.